Welcome to Health and Longevity by Barbara. Are you interested in reverse your age in 15 years? Would you like to live long and healthy life without medicine and surgery? So we are happy to have today our guest, Dr. Grażyna Pajonin, who gained her PhD in electronic engineering, but what is very important, she has reversed her age on 15 years. So I would like to ask you if it was possible for you, it is really possible for everybody?
Yes, Barbara, thank you for asking me that question because I'm very passionate about this topic because it is possible for everybody. And you know what? It's proven. It's scientifically proven. And Harvard Medical School, they have made experiments on mice right now where they could reverse the age of mice. And on top of it, they have proven that we have in our body the information about our youth is stored in our body, and we can reset it, believe it or not. So imagine it will be like a computer that we just push a button and reset it to the younger version of ourselves. So at this moment, this is proven on mice, but there is also indicator and how we can move towards human beings. Then first of all, we have to understand that there are two ages. Everybody. One is chronological age. So for example, in my case, I'm 72. And there is nothing I can do about it because I was born on Saturday and I am what I am, right? But fortunately, there is another age, which is called biological age. And this age, we can change. We can influence certain biomarkers in our body, and we can change that age. So in my case, it is proven that I am 58. So now let me ask you a question. Am I 58 or I'm 72, right? That's the big thing, that we have in our hands possibility to reverse our biological age. What does it mean? It means that you can live healthy life all the time towards the end of your life. You can enjoy this life. You don't need to have all these medications. You don't need to have surgeries. Really?
Yes, really, because it is the most important, not only how long you live, but what is he is in what condition. Yes,
Exactly. You know, you can travel, like we are going to Europe in 2 weeks. And like my son is laughing and said, Mom, sometimes we have to run to catch another plane, and you are running with the suitcase and with everything. Of course. Of course. And yes, guys, it is in your hands. You can do it too. So let's talk about it. How can we do it, right?
yes, but the first, please explain what is the main reason for aging? Why?
There are many reasons, but that's you know, and I can just mention all of them, but you know what, the main reason, let's see, the easiest to correct it is that we are drying out. Have you noticed that the skin is becoming like paper? You know, we are, no matter when you are older, no matter how much water you drink, you are dehydrated. We are drying out. So what does it mean? Because we are losing the main components of the connective tissue. So the generation of connective tissue causing many of our problems, such as problems with joints, problems with skin, and connective tissue, Barbara, is about 80 to 90% of our body. So it's not only what you feel in joints, your joints, it's not only what you see in your wrinkles, but also cardiovascular system, also digestive system, also, entire your eyes, your gums, your hair, everything, So the reason the first reason, and there are many reasons. As a matter of fact, I wrote a book about this, and you can get it and study it. But the most important, the first thing to correct is to help rebuild your connective tissue.
Yes, it's very
The
important.
other things, of course, is we need to also stop the inflammation, the chronic inflammation in the body, because that causes a lot of problems. And the next thing is digestive system. So, the cleansing the digestive system is very important. And you know what? I talk to so many people because I work in this field for 12 years. And this is sometimes shocking that people do not understand that they have to start worried about it, not worry, but actually maybe thinking about it when they are 20 and not wait till they are 60 to start reversing the process. Because if the whole thing, what was proven by science, is that our body is so powerful that our body can rebuild itself. But we need to give our body the right conditions and the right material. It is like you cannot send, the very good workers to rebuild your house and don't give them the material, right? They give them the bricks and cement, They said, you are very good, so you can deal without it, right? No, we have to give them the material, and then our body can rebuild itself. And I've seen it over and over and over.
Yes, of course, it is very important. I think that everybody knows how important is sleeping and eating, exercise, and have take supplements. But now I think about it that sometimes, or even very often, people take care about themselves. We take care about ourselves, but even though just with when we are older and older, even though we take care about ourselves, we do everything correct, including positive thinking and being in good mood. We notice that our skin doesn't look like we would like, and also our joints aren't in this good condition. So why it's happened? Can you explain to us?
Yes, this is an excellent question, because we have a lot of clients who are like that, who are just taking care of themselves. One of the example was my husband. He was the one. He was taking care. He never was overweight. He was eating correctly, never overeating, taking care of himself, exercise. Because listen, without exercising, you can't achieve good results. But exercising are also important to do them correctly. You cannot just say, okay, I put 350 pounds, when we were on your joints, or run marathons. No, 20 minutes a day movement, different type of movements. But you are right, Barbara. Many people they know that because it's well known, right? And they do the right exercises, they take care, and they still have problems with joints. And we are coming back to the reason, because no matter if, when once the connective tissue will degenerate, there is no way that you can rebuild it just from food. And this is the problem, that we need the right supplement. And this was something that many scientists from all around the world were trying to get to so that we could start rebuilding, especially synovial fluid in our joints, but they could not, because in the nature, the molecule of hyaluronic acid, which really is the synovial fluid in our joints, which is like oil in your car, in your motor, you know? So, and they couldn't get it back because of that huge molecule. So this is the problem that, let me ask you a question, how far you can drive a car without an oil? So the same, how many years you could use your joints without rebuilding the synovial fluid, which is made from hyaluronic acid. So the problem is why we are, the biggest problem is the generation of connective tissue. And the problem is that we are losing on average about 1% of the main ingredients which are building your connective tissue. That is collagen, hyaluronic acid, and chondroitin sulfate. They are the three ingredients which are the main ingredients. And because they drop and you're losing it about 1% every year, so there is dropping, and we can't get them back from food or exercises alone. You
So,
know?
excuse me, so but I thought that our body produce collagen and hyaluronic acid. No, it's not
Absolutely.
enough.
Absolutely. Our body is able to produce it. However, in our Western society, that is, in our Western society, is that we are losing more than we produce. So we are in deficit. So like you would be spending more money than you make, right?
Yes.
Every single month. So imagine where you end up. It is the same thing. We are simply losing. And unfortunately, from food, in food, once before we lose it, because there are some places in the world, like blue zones. People live without doctors. People don't get sick. They don't have wrinkles. So are they superhumans? No. Scientists went there and studied it, and they found out that those people, from the birth, they have their lifestyle, that and their food, and the clean water, and then clean air and everything. And they work on their own, to produce their own food. They don't buy from the store processed food. They just, and then in the evening they gather together, don't watch television, but they sing songs, they socialize with each other. This is their lifestyle. And you know what? They never lost it. They never lost these main components of connective tissue. So they live fine. But imagine this type of lifestyle here. It's impossible to implement it. It's impossible. So we have to do the second best and supplement. So if we are able to rebuild it and give the body says, yeah, I'm losing it. Please give me back. And it's taking, and we can rebuild it. So this is the reason why we have to supplement, because we are losing more than we can produce. So that's it. And it's very, very important to supplement, but at the same time with supplementation, you have to be also very careful. And of course, you also have you are also functional nutritionist, Barbara, so you know that we cannot do too much of anything. We have to use the right amounts what our body needs. Give the body what it needs and it will rebuild itself.
Yes, exactly. So what you said, now we know that we need to supplement collagen. So is every collagen the same? What we
That's
should
a very
do?
good question. Collagen, okay, let me ask you, have you ever made a cake?
Yes, yes, of course.
Okay, how good will be your cake if you use only flour?
No, I couldn't do anything.
Okay, the same for the body. When you give only collagen, it's like making a cake from flour only. You know,
I need yes, water, and I need eggs. Just something
exactly.
what
But also, if you put them not in the right proportions, but randomly, this one something, this something, this something, mix it, put it to the oven. What kind of cake you get? Anybody would like to eat it?
now it will be disaster.
That's exactly what the body, this is something amazing. Of course, if you put little bit of collagen in the body, it's better than not, especially if this is absorbable one. So it has to be hydrolyzed. However, in order to rebuild your connective tissue, the body has to get something that the body can understand. It's like making a cake and have all the ingredients in correct proportions. So the GMP labs from California discovered an in a natural source that has, believe it or not, this is amazing discovery. They discovered that this natural source is bioidentical to our own connective tissue. So what it means that it's already mixed. All components, not only those three, like collagen, hyalurononic acid, chondroitin sulfate, but other glycoaminoglycans there in exactly the same proportions as in our own body. So that was a huge discovery. And then there was still a problem of the size of the molecule. Because as I said, this is nature. And nature have huge molecules. Our body can't absorb it. So this is why we cannot eat that source, right? Because, it will be too large. So the scientists from Harvard, Stanford, and Cornell worked for 20 years on this problem to not only find what is the optimal size of the molecule. And remember, optimal, not too small. It is Gaussian curve. It has to be not too small and not too large. They found the optimal size of the molecule is between 1.5 and 2.5 kilodaltons. That's it. And then they made it. So for the very first time, we have something that it's not only directly from nature, and nature it cannot be corrected. I mean, you cannot say that I just made a mixture here, it's better than nature. No, nature is, if there is something in nature, our body loves it the most. So we have directly from nature with optimal size of the molecule. So the absorption rate is anywhere from 95 to 98%. So now what you do, this is called collagen hyaluronic acid matrix. And what you do, you drink it, it is in liquid form. It has 37 clinical studies proving its effectiveness. It has 7 US international patents and tons of awards proving that is extremely effective. You drink it, you keep it under your tongue, and for about 20 seconds. The very important is to take it twice a day, morning and night. Keep it under your tongue, and it will go directly to your molecules and to your body, to your bloodstream. And it will start rebuilding the synovial fluid in your skin. And I showed you the pictures, and I can show you the results. I mean, they are amazing. So we can show it maybe later, or but it would be nice if you could see it.
Yes, yes, of course. So it is amazing that we have this possibility. But I am thinking about this when we should start to supplement, when we have this problem, when we notice that we have problem, or earlier when our body just when is this moment? Maybe when we are 26 and started to I start the aging, or maybe a little bit later, earlier, when we should
Well, let me
start
ask you a
supplement.
question. When would you clean your house? Well, every 30 years?
No, exactly.
When would you paint your house to maintain it? When are you going to change the oil of your car? When it already doesn't work?
Oh, no, I have to remember when is this. Yes, this date.
Exactly.
Mhm,
So just imagine that you have only one car,
mhm.
that you never ever can buy another car. That is especially for men. Imagine that you have just one car. What kind of oil you will give to the car? What kind of would you invest in a good gas?
Yes, yes, exactly,
Would
because
you wash
I
your
would.
car,
Mhm,
right? But
mhm.
you have only one body, and you already know it's going to degenerate your connective tissue. So let me ask you, is it easier to prevent the damage, or is it easier to fix it later on when
Yes,
the house already falls on your head, right?
yes, of course. Just thinking about car, everybody has to check what is the proper oil and what is the best gas, because we want to keep our engine in very good condition as long as possible, not to repair it.
Exactly. And the same is with our body. We are getting gift from God, that's beautiful body. And if you do not take care of it, the body will degenerate. So just imagine that you have the degeneration process starts when we are 25, when they stop growing. So just imagine that you give it, like for example, my son, he started this at 27. He has no wrinkles, not at all, no problems with any joints, nothing. It's and do let's say you are a woman and you want to keep your beauty, right? So when would you start? Would you start when you were 60, when you already see, oh my God, I have wrinkles, and then you start reversing? It's better than not at all, that's true. However, if you start earlier, you don't develop them, because you have to understand why they show up. They show up because we have degeneration of connective tissue, and the skin is the largest organ. So it shows on your skin. So imagine that you put back all the time those components, and the body is rebuilding itself all the time. You prevent that. So you never really dry out. Even the doctors, when they later on inject your Synvix, which is hyaluronic acid, to the joints, they have those big molecules. So it's always a filler. When the dermatologist will inject the hyaluronic acid under your skin, it's a filler. Filler is not going to rebuild. This collagen hyaluronic acid matrix is going to rebuild your skin and your connective tissue and your joints, and you can start feeling great again.
So when we start to feeling great again, can we stop because it is everything just repaired, or still?
Well, let's see. Again, let's go back to your house. So let's say you had a hole in the roof and you fixed it. Are you going to stop maintaining your house, or you still need to maintain it from time to time, right?
It is
You
obvious.
know, the aging process is not going to stop because we are where we are. So we can put on the maintenance dose, just to put enough to counteract the loss. But the good thing is when you use this collagen hyaluronic acid matrix, you activate your own generation of 3 collagens or collagens and hyaluronic acid in your body. So it's not only supplementing, but also, encouraging your body to generate more. So that's why we don't need so much anymore. Once you rebuild it and okay, I feel great now, I look okay, you just lower it to maintenance dose and just give it as much as possible, as much as is needed.
I understand now. So when we use this proper collagen, I understand it is very helpful. But I remember you mentioned about exercise on the beginning. So can you explain to us why it is so important and that we should exercise, and it should be something special, or does we should move? What we should do?
Well, our body has been designed to move. We were not designed to sit. So it's absolutely necessary. It's especially for our joints, for our well-being, for our skin. Look, when you go and actually there is a video on that we can show you sometime later when I created so that we can see what kind of exercises we need to do, because the idea is that you have to know, let's say you have a problem with your knees, so you do not exercise on for knees, and you have to know how you can start rebuilding. But if you exercise, it's like you speed up the whole process. So you, even when I go for bar classes, let's say. So when I go there, I noticed after the class, like my skin is glowing, is glowing. It's totally amazing. Our body needs exercise now, and all of us are busy, right? You, Barbara, are so busy that it's very hard. I can get you on the phone. But what about getting up 20 minutes earlier and do 20 minutes ecliptic, or 20 minutes stationary bike, or 20 minutes squats, or something, some routine, something for you. So you have to invest time in you. You go for a quick walk, interval walk, so that your heart is also working. Because guess what? Anything we don't use disappears. And then you have problems with your muscles and so on. So it's necessary to exercise properly. And if you have the biggest problem, which I notice, is that people think, oh, I have a problem with knees, so I have to exercise on knees. No, you have to, the knee, everything in your body is connected. So we have to have hip exercises, joints on your feet and everything. You need to make them flexible and stretch. So there are 3 types of exercises: stretching, strength, and cardio. And all 3 you have to somehow incorporate in your lifestyle. But do not overdo. Even 20 minutes a day, but regular exercise will do the job, the work for you.
But when we have arthritis or joint pain, we should do the same, or you can tell us that that there are different exercise for people with arthritis or
Well,
joint pain.
first of all, yeah, I have the whole program of that, so you can listen to this. So you have to listen to your body. You have to listen to your body. You cannot overdo. You have to stop if there's too much pain, but you have to go through pain. So certain pain you need to tolerate because you still need to put that synovial fluid, so to speak, to your joints and but I try this. So you have many methods to help yourself when you have arthritis, but the best way is to listen to that video. And I also gave the special in the when description of that video. There is and Barbara, you could put a link under the those
Exactly.
video to that one, because it's it's an a 30-minute video, so I don't want to talk about all of it right here, but remember to look at the description, because I put the special exercise programs under each of those under for different problems. Like people have problems with shoulder, people have problems with knee, or people have problems with lower back, and so on. So it's but you know what the good thing is that about we're working with this field about 12 years, and I would tell you that people who follow our program, about, I would say 90% of them get results, which is amazing. No
Amazing.
surgery, people who were scheduled for joint replacement, people who were scheduled, who wanted to do the plastic surgery. You can still do the plastic surgery, but imagine, you rebuild your skin and then make some correction. You will have much better results. And for the professional, if you are professional in the field, if you implement this with you will have much better results with your client. So you get more clients because you will get more referrals, because the clients will be extremely happy with your, procedures and whatever you are doing. So that is the same for the fitness. If you are in the fitness, if you have still advise your clients to use that collagen hyaluronic acid matrix, and at the same time as you work with them on the fitness in a program, they rebuild this connective tissue, and they rebuild those joints. They hydrate their joints. Imagine what kind of results you can get. So you will again attract more customers. They will be more happy with the results. They will be more flexible. They can put more into the program. We had a guy who came to us from Canada, who couldn't hold on a glass in his hand. He had problems with his shoulder, and he was a professional weightlifter. And he said, "Can you just help me to just get back to the gym? I loved it so much." And the doctors told me I will never be able to go to the gym again. And guess what? After 8 months working with him, it's not only that he went back to the gym, he was pushing 350 pounds, and he won the world record in his age group. He broke the world record in his age group, and he won the Canadian sometime competition with weightlifting. So can you do it too? Yes, you can. My husband had a problem with shoulder. He was not able to move this arm at all. It was like this. And in 3 months, by accident, he was very skeptical. He didn't believe it can work, possibly, because the doctor said it's too damaged. It has to be replaced. You have no chance. But but he didn't want because he wanted to water ski. He wanted to be active in sports. And guess what? In 3 months, he was able to move the arm. In a year, he told me he has brand new shoulder. And that was 12 years ago. And he has his brand new shoulder till today, you know? So, is it worth it? You have to answer that question for yourself.
Yes.
Because you know what? The plastic surgery, I don't know if you can see. People were betting that I had some plastic surgery. I don't. I don't have any Botox. I don't have any plastic surgery. And wherever I go, people say, what? You were 72? It's impossible. But I'm almost 73 and I am getting younger each year instead of older. Do you like to do that? You have to answer your question. If you do, get in touch with us and we can help you because we know how to do it. We have done it successfully and you can do it too.
Yes, I of course agree with you, and I have my own story also with my shoulder, what I did. So it was, as I mentioned, that sometimes we do absolutely everything correctly, but even though sometimes something happened, so it's something happened with my shoulder, but it is not time to explain about it. But I am also example of this person who had a very big problem with shoulder. I did everything and I couldn't manage this situation, but I started to take this special collagen, and after half a year, now I can move this shoulder. I can show that, but it was impossible.
I
Yes.
was talking, Barbara, to the doctor, professor of orthopedia, who took time to study this collagen hyaluronic acid matrix. He was fascinated because he said orthopedic surgeons were waiting for something that can rebuild that synovial fluid, because you can't rebuild it with anything else. And there is no blood supply anymore, to your joints. So no matter what kind of supplements you take, it doesn't get there because there is no blood. So the only way to put nutrients to your joint is through synovial fluid. So if you destroy it, then you have bone on bone, and you destroy your cartilage, and you have pain. So if you rebuild it, then you put the synovial fluid back, and because it's optimized size of the molecule, you start duplicate the molecules of the cartridge. And this is what we would advise you or help you to do if you choose so, And remember that if you do the joint replacement, what is the problem of joints? Degeneration of connective tissue. So ask yourself a question. If I do the joint replacement, does that solve that problem, which is the generation of connective tissue? Right? Doesn't. So what does it mean? That the generation of connective tissue is still going to progress. So what does it mean? It means that there will be next joint, that will be gums. There will be eye problem. There will be skin problem. There will be other problems, cardiovascular problem or digestive problem or any other problems, because you did not solve the main problem. That's our advice.
Exactly, but so in conclusion, summarize our meeting, what can you recommend others to do to how to supplement our food just to still be healthy and even reverse our aging? Just to summarize.
Very good question, Barbara. When first of all, get in touch with us. And the number one is rebuilding the connective tissue. And you can't do it with anything else except from this patented collagen hyaluronic acid matrix. We can tell you how to get it, which one, because there are several types. So we can advise you which one to take, how much to take, and we can follow with you your progress. We are not just going to sell you something. We are not here to sell you anything. We are here to solve your problem, but everybody is different. Everybody has different problems. So that's number one. Number two, digestive system. So we have to talk to you about your nutrition. We are qualified in that. We are functional nutritionists, so we will talk to you about that, so that you have to have anti-inflammatory diet and other stuffs. So we work with you on that. So that will be the next thing. Then maybe we can help you with inflammation, so that we can help you with this. And after this, we can, maybe you would be, the best thing to do is to do the test for all the biomarkers and see which biomarkers you want to correct, and then choose the suitable supplements for yourself. So it's personalized for yourself to correct those biomarkers which you need to correct, and not randomly run. And, oh, I have heard that I need the vitamin D. Oh, I have heard that I need this. Oh, because then maybe it was too much. And too much is also very bad, of anything. So this is my advice. So my advice is use the link under this video and book a call, talk to us, and we can help you to set up your personal program. And if you want to just get this collagen hyaluronic acid, yes, you can do it. However, it would be still very good to talk to us, because we can instruct you how to take it, how long, and what is the dosage, so that you can achieve what you want to achieve.
Thank you very much for this explanation. Thank you for all important information. They are really vital. And thank you everybody for listening to us. And please subscribe, and I invite you to our next video. Goodbye.
Thank you so much, Barbara. It was a pleasure. Thank you.
Goodbye. Thank you.
Bye. Bye. Mm.